Given the economic climate all of us have seen in the past few years, we don't need to be reminded that many of our patients are out of work, as are many of our friends. What we as cardiologists have to remember is that employment instability is a major source of stress, and that little is known about the cumulative effect of multiple job losses and unemployment on the risks for acute myocardial infarction, for example. Now in the Archives of Internal Medicine, researchers investigated the associations between different dimensions of unemployment and the risk for acute MI in more than 13,000 people aged 51 to 75 years in the Health and Retirement Study in the United States adults in a prospective study. 14% of the subjects were unemployed at baseline, 70% had one or more cumulative job loss, and 35% had spent time unemployed. Here's the bottom line. Multivariate models showed that MI risks were significantly higher among the unemployed with a hazard ratio of 1.35, and risk of MI increased incrementally from one job loss to 4 or more cumulative job losses. People with 4 or more job losses have a hazard ratio of myocardial infarction of 1.6 compared to those with no job loss. Risks for acute MI were particularly elevated within the first year of unemployment. Results were robust after adjustments for multiple clinical, socioeconomic, and behavioral risk factors. In an accompanying editorial, Dr. William Gallo from the City University of New York makes an important point. He states that sufficient evidence now exists about the negative influence of job loss on health. The next generation of studies should identify the pathways from job separation to illness so that non-occupational interventions may be developed and targeted to the most vulnerable individuals. I'm Peter Block, and this is a CardioSource Heart Minute.